At the beginning of November 2021, Premier Doug Ford, Premier of Ontario, was in the news a lot over, quote, refusing, unquote, to require that staff at medical facilities be vaccinated against COVID-19. A lot of people have been talking and asking about this, so I thought it would make sense on Don't Talk TV to look at the laws and what's going on and clarify things a little bit. Hello, my name is Nicholas Wansbutter. I'm a criminal defense lawyer in Stratford, Ontario, Canada, and welcome to Don't Talk TV. So, COVID-19 continues to be on everyone's minds, as with these vaccine quote-unquote mandates. Are they laws? Are they mandates? Well, it depends on where you are. It's been in the news a lot lately that Quebec, the province, was going to require by law that all medical practitioners, nurses, doctors, caretakers, anyone working at a medical facility would be required to take one of the COVID-19 injections that have been approved by Health Canada in recent months. So that was big in the news that Quebec was not going to be mandating that. They had said they were going to mandate it, but because so many nurses and other medical practitioners were declining this particular medical treatment, they realized that they were going to collapse the medical system and they had to back down. Similarly, it's been in the news a lot that Ontario's made a similar move. Although, I think it's important to look at the laws, what the law actually was, because in my view, all that's happened here is that the status quo has been maintained. So let's take a look at what's been in the news, and then we'll take a look at the laws. So just to establish what we're talking about, as I generally like to do, I'm going to look at a CTV News article. This one's titled, Doug Ford refuses to make COVID-19 vaccines mandatory for Ontario's hospital workers. And just here, it says here, Premier Doug Ford has announced he will not mandate COVID-19 vaccines for hospital workers, saying he's, quote, not prepared to jeopardize the delivery of care to millions of Ontarians, unquote. And it just says that Ford said the government will keep monitoring the situation, but has decided for now to maintain a flexible approach by leaving human resourcing decisions up to individual hospitals. So, as always, he's leaving himself wiggle room to back down on this at a later date, saying just for now. We've seen Premier Ford flip-flop on a number of issues, starting out with I'm not going to do a lockdown, to there being lockdowns, to 2 weeks to flatten the curve, to being months and months of lockdowns, to I'm not going to implement a vaccine passport, to implementing a vaccine passport. So this could very easily change, but as of right now, by law, the province of Ontario is not requiring hospital workers to receive COVID-19 injections. Now, as I said earlier, in my view, this is just maintaining the status quo. So in support of that assertion, I'm looking at the COVID-19 Directive number 6 for public hospitals within the meaning of the Public Hospitals Act, service providers in accordance with the Home Care and Community Services Act, etc. This was an order issued by Dr. Kieran Moore, the Chief Medical Officer of Health of Ontario. It was issued August 17th, 2021, came into effect September 7th, 2021. So this is the most recent directive concerning COVID-19 vaccinations in hospital staff and other healthcare providers that's been in place and has been the governing law for a couple of months now. So right here, Section 1 has the required precautions and procedures. So every organization must establish, implement, and ensure compliance with a COVID-19 vaccination policy, requiring its employees, staff, contractors, volunteers, and students to provide one of these three things. 1, proof of full vaccination against COVID-19, or written proof of a medical reason provided by a physician, etc., or proof of completing an educational session approved by the covered organization about the benefits of COVID-19 vaccination prior to declining vaccination for any reason other than a medical reason. And it says the approved session must include at minimum these 5 things. Section 4 here then says every covered organization vaccination policy shall require that for someone who does not provide proof of being fully vaccinated against COVID-19 will submit to regular antigen point of care testing for COVID-19 and demonstrate a negative result at intervals to be determined by the covered organization, but at minimum once every 7 days, and provide verification of the negative test result in a manner determined by the covered organization. Going to the end of this document, there's nothing in there about terminating or putting on unpaid leave individuals who have not been vaccinated against COVID-19. that's why I say we're just maintaining the status quo. We're in the same situation that we were in previously, where the Ontario government is saying that hospitals and other medical facilities have to have a policy. That policy needs to give certain options, and it says that for those not vaccinated, they have to do testing. Doesn't say anything about firing individuals. So this is important because this is not a government mandate or law. It's nothing coming from the government of Ontario. This is purely individual hospitals making on their own the decision to terminate employees or put on leave employees who've not received COVID-19 vaccination. If you're in a situation where you're facing that, you certainly should consult an employment lawyer if you can. Now, unfortunately, most hospital employees are unionized, so that means you have to work through your union, and the grievance process laid out in your collective bargaining agreement is really your court process versus ununionized people being able to pursue it in the courts. But in my view, and I stand to be corrected if there's lawyers with a lot more employment experience than I have, as I've stated many times on this channel, I've been a criminal lawyer my entire career. But my understanding is that employees at minimum should be entitled to severance pay on a termination without cause basis. I don't see how employers can make it termination with cause. They certainly can't argue that the government has frustrated the contract, because the decision to terminate employees for not being vaccinated has nothing to do with any government law or regulation. So this video is not legal advice. If you need legal advice, consult a lawyer. You can either call another lawyer or myself. As of the preparation of this video, November the 10th, 2021, I'm not able to take new clients currently, but if you're viewing this video in a month or so, I should be able to. So my 1855 number and my website are listed below. If there's topics you'd like to see me cover, please continue to send emails to the email address listed or leave comments in the comment section. And if you found this video at all interesting, helpful, or informative, please consider liking, sharing, subscribing, and following us on social media.